The way I like to explain the differences between the bile duct system and the liver cell system to my patients is by making an analogy of a tree. A simple tree has multiple leaves that when you look at a tree from afar, you don't actually see the twigs, branches, all you see is the trunk. And that's very similar to the anatomy of a liver. The liver cells in that example are the actual leaves. The twigs, branches, and the trunk are the bile ducts.
So most of the time, people's symptoms of bile duct cancer are very similar to symptoms from any number of more common conditions like upper GI infections or gastroenteritis or stomach bugs, where people might have some pain in their belly, some mild nausea, sometimes some vomiting. Those kinds of symptoms will usually take them to their primary doctors or your regular family doctor, who eventually may, or hopefully sooner than later, will order some blood tests to check if the liver tests are normal and if they see dark color, yellow color of the eyes, or if somebody reports to their doctor that the urine's particularly dark, the doctor will probably order some liver function tests, which will show high bilirubin, which is a protein in the blood that builds up when the bile ducts are blocked.
It really comes into three different categories that we like to put them in. The first is the intrahepatic cholangiocarcinomas, and then giving that same example of the tree, those are the twigs. So the tumor developed from one of those twigs, but it's in the substance of the liver, so it grows and grows. Then there's we call it extrahepatic or perihilar tumors. Those are tumors that grow from the main trunk, and that's the classic Klatskin tumor. And those are tumors that they actually have different types. It's classified into type 1 through 4. It's based on a bismuth correlate system. And that describes physically where these actually grow. Most of the time, these tumors, when they present, it's at an advanced stage just because of how they grow and physically where they are in terms of the anatomy within the liver. The last, or the other category, are the distal cholangiocarcinomas. So these are the ones that are, using that same analogy, are in the trunk or at the base of the tree. And physically, where they lie is within, actually it's just on the back side of the pancreas. Sometimes within the pancreas, for just a small amount, there's like a little groove of pancreas that surrounds the bile duct. And the same cells within the lumen of the bile duct is what gives rise to these tumors.
The location of bile duct cancer can definitely impact how people present or come to be diagnosed with their cancer. So sometimes people who have a cancer inside their liver, it can go for quite some time before it leads to a blockage or enough cancer to be noticed. And unfortunately, people with the intrahepatic type of bile duct cancer, intrahepatic cholangiocarcinoma, will often have quite a bit of tumor or multiple tumors or tumors that have even spread outside the liver before they even develop any symptoms. And that obviously is a very difficult problem to be faced with, to have an advanced cancer out of the blue before one even had a sign of such a cancer.
These tumors tend to grow slowly and they grow over time. We don't have any specific nerves that we can sense in our bodies, specifically in that area. So these tumors tend to grow very large, and it's only when they start to block different structures that you end up having symptoms and the patients will recognize that they have a problem. Probably the most common symptom that I see are patients who have large tumors that are growing in the right side of the liver or the left that irritate the diaphragm, and then that usually generates pain in their shoulders. I often say that up to about 2-3% of my patients always have evaluations by orthopedic doctors before they come and see me. And they've had MRIs of their shoulder, and they're saying my shoulder pain, and they've had all these evaluations, and all the while this tumor is growing in their liver.
Well, the first thing as the doctor, the first question we ask in an oncology clinic is, can this cancer be removed by surgery or any other way to get it out of the body? And something that's very important for primary doctors to remember is that it may be, if it's a tumor that might be able to be removed by surgery based on the initial scans, it's best to see a specialist at a center that's experienced with bile duct cancers before doing anything else, before putting a needle in to do a biopsy, before going to a general surgeon who may not be experienced with bile duct cancers, which can have their own unique surgical considerations. And so I think a key question to ask one's doctor before doing further workup for a liver tumor in general is, should I have a consultation with a specialist, a surgical specialist or an oncologist who might be able to give the most specific advice for that set of problems before doing any invasive procedures to make sure the first procedure is the right procedure.